Hi, and welcome to NANNcast. I'm Jill, your host. I want to share with our listeners NANN's message regarding their position statement with the National Perinatal Association on mothers with COVID-19 and their newborn infant, focusing on shared decision-making. As the COVID-19 pandemic continues to shape all of our lives, those who provide care to the pregnant parents, their families, and newborns face a challenging task. We are entrusted with the responsibility of formulating new policies for childbirth and newborn care in the midst of a dynamic public health crisis. So how do you create evidence-based guidelines when the evidence is evolving? Parents and providers get new data every day, and the information we need to make informed decisions is ever-changing. This not only possesses significant challenges in creating a safe environment for patients and first-line healthcare workers, but also in maintaining the highest standards of ethical and compassionate care at such a potentially vulnerable time for both parents and newborns. The National Perinatal Association and NANN recognize these unique challenges and offer guidance in creating a culture of shared decision-making when providers must deliver the newborn of a COVID-19 mother or when the mother is a patient under investigation. Drawing from multidisciplinary experience of our organizations, we have created a joint position statement addressing the need to balance evidence-based practices for both infection control and protection of healthcare providers with the established benefit of newborn bonding and breastfeeding in the fourth trimester. It's a great pleasure to welcome Dr. Tiffany Moore, the current chair of NANN's Nursing Research Committee and an executive board member of the National Perinatal Association. Utilizing her passion and research in reducing chronic stress in mom and baby, she is the author of the current joint statement, Mothers with COVID and Their Newborn Infants. Today, we hope to answer the overarching questions which occur around our role as NICU nurses in these uncertain times. Let's get right into it. Hi, Tiffany. I appreciate you taking your time to talk with us today.
Yeah, thank you so much for having me.
Tell us the story behind developing this position statement and why it was so important for NANN and NPA.
Yeah, so I am actually members of both organizations. I am the chair of the Nursing Research Committee for NANN, and I'm on the executive committee for NPA. And I know both organizations are very passionate about family-centered care, about maternal-child outcomes, and really understand the importance of attachment in mom and baby. And so I thought it was great to bring two organizations together that have the same beliefs and just really provide a powerful statement that supports really mom's shared decision making in this era of pandemic world that we're living in.
You know, as NICU nurses, we really like to focus on family-centered care, as you mentioned, and bring the family together and do some shared decision-making on what we're going to do with our plan of care and, how they interact with their infant. And attachment is really important. And, we do focus a lot on attachment during the golden hour. What do you think ways that we can use this position statement to enhance attachment with mom and baby?
Yeah, that's a great question. And that's really a big reason for this position statement is that mom needs to be aware of all of the risks involved. That includes the risks of the attachment that may be disrupted if mom is separated from baby immediately. We know the effects of the golden hour, not only on the physiology of, oxytocin and hypothermia, but really how this affects the innate protection behaviors, disorganization in baby, and really affects bonding in mom and baby, which also can affect mom's emotional health.
Yeah, I know it's, a stressful situation for these parents, especially the mom, when, their delivery plan isn't going to be the same as they expected. Most places only allow one support person. So, going into this with all this uncertainty and stress and then having that, feeling of added stress to not be able to adequately bond with your baby, especially, if these moms are, have COVID positive or if they're under investigation. So, it's really important as NICU nurses that we have all this information so we can provide the best experience for these moms and really hope to promote bonding.
Absolutely. It really is important to, again, emphasize. I mean, the stress of the NICU itself is really a traumatic experience for most parents, if not all parents. And so, during this pandemic, I mean, like you mentioned, there's so many uncertainties. Mom and dad aren't able to be in the NICU at the same time. And so, as NICU nurses, it's really important that we acknowledge that grief they're going through, including the grief of any fears they have of COVID. And then, really, with the recent events of all the events around the racism and all of the riots and the protesting. And there's a lot of emotion going on right now. And so, just as NICU nurses, recognizing those traumatic events and then add on top of everything the experience of the NICU. So it's really our role to provide trauma-informed care, to really acknowledge that grief, and to check in with these parents.
Yeah, there's so much trauma going on right now in the world, and compound that to the typical daily trauma these parents are experiencing in the NICU. You really, you notice these subtle changes in the parents' behavior, and you have to kind of put everything into perspective. Like, they're dealing with issues of even just getting into their NICUs because of all of the protests that are going on to see their baby, and then couple that with, having visitor restrictions. So it is very traumatic and very stressful for these parents. And I like to think as NICU nurses, we can be very resourceful and try to figure out ways to promote bonding. But, with these policies are always changing every day, and we're always getting new emails, and just to, sift through that and figure out what's the new flavor of the day, so to speak. So I think it's really important that NANN and NPA put out this position statement, because it's a nice resource for nurses, so they can really make sure that they're, providing that care that these patients need, but safely, and thinking about, the safety of the other nurses on the unit and the medical team, as well as mom and the baby, and making sure that everybody's safe.
Yep, exactly. And, in thinking about, how I approached this statement was really thinking about evidence-based practice. And what do we, use in evidence-based practice? Well, we use the three major components. We look at evidence. And so looking at the evidence and staying up to date on the current evidence, and, what do we know about the effects of newborns? Are there an increased risk in getting COVID or getting sick from COVID? So just being aware of what's been published, and then the clinical expertise of those around you. If this is if the baby has, or mom has, different high risk situations, then every situation is different, and bring in your clinical expertise, but of all the team members, and that includes a very important part of the NICU nurse role, to be a part of those conversations. And then, of course, the third component of EBP is patient preferences. What does mom want? What does mom need in this moment? And then really just acknowledging that her needs and her wants may not be able to be fulfilled. So, just acknowledgement itself is so powerful during trauma.
So we're talking a lot about the stress on moms and the families, but why don't we talk a little bit about the toxic stress on these babies that are in the NICU?
Yes, absolutely. We know just being in the NICU is a stressful event for the babies. You have the environmental stress, you have stress from painful procedures, from noise, everything. And then you include the stress of the psychological distress of attachment and disruption of those natural attachment processes. And so, really we're starting to understand more and more about the role of toxic stress in early childhood. And when we talk about toxic stress, usually we're talking about those adverse childhood experiences that, babies, infants, children experience, including poverty, including abuse. But we're also recognizing the toxic stress in the NICU itself. And so, again, it's important that we recognize that if the bonding that is not able to occur with mom and baby, that's affecting baby's emotional development. Their social emotional maturity starts from day one. And so, when we interrupt that golden hour, whether it's because they're separated for COVID or whether because the baby is too sick and they need to be transported to the NICU, really making sure that we recognize and educate mom on the importance of, hey, when you're here, we really want you to do that skin to skin. That's so important for baby's development. It's so important for your emotional development as a mother. And so just really trying to decrease the amount of toxic stress that we can actually control in the NICU.
So we've been talking a lot about trauma-informed care. Can you, take some time and explain that a little bit more, and tell nurses what ways we can provide trauma-informed care both to the mom and the baby?
Okay. Yeah. So, such an important topic. And it's really a very interesting topic that is newer. So, there are a lot of resources that are popping up everywhere. But one of the resources I would recommend is the Substance Abuse and Mental Health Services Administration. That's through the government. And they actually have a book and website. There's also the National Center for Trauma Informed Care. And then I also have to, of course, acknowledge that NPA has a staff education course that talks about psychosocial support, specifically for NICU staff. And so when we talk about trauma-informed care and what these resources will really help you identify, there seem to be about 6 principles that are associated with trauma-informed care, and that's safety, making sure that mom knows this is a safe environment, knows that you're a safe person to talk to, really providing that peer support. If you're not able to directly relate, acknowledge that, but maybe there is someone that can relate to mom's circumstances, whether it's, gender, culture, race, anything, and then collaborate on really how you're going to move forward and how, what does mom need? So let's collaborate together to identify how we can make this experience less traumatic. Trustworthiness. I mean, we know nurses are the most trusted profession. And so, we need to use that trustworthiness that patients have with us and just really make sure that they know that they can trust us. Empowerment is such a huge thing to give these moms, especially with everything going on, just giving them the power to make their own decision and to really feel like they have a voice. And then, really taking into considerations the cultural situations, historical events. Again, I can't emphasize enough the extra trauma that the United States is really facing with, the death of George Floyd, and really has risen up the talk of racism, and it's really exhausting. I know as a white woman, it's exhausting for me, and it's heartbreaking. But I can't imagine what it's like for our Black moms, right? So, just really being able to say, hey, I acknowledge this is happening to you, and I want you to know this is a safe place. And just really trying to not re-traumatize them. And, it's so powerful. Just the words, I'm so sorry this is happening to you, or I'm so sorry that happened to you. Those words are simple and powerful. And then really just sitting and listening, just listening and acknowledging, wow, that must have been so difficult. Those are really, we learn that in our therapeutic communication skills in nursing school. And it's just so important that we really think about that as we approach moms, especially during this pandemic and this time of enhanced racism.
That's so true. It's we have to think about the world events that are occurring around us. You know, when we're talking to these moms and the dads too, and we talked about post-traumatic stress in an episode, and these parents are experiencing that, and it's just we might have to take that added extra time to communicate with these families, and just like you said, listening, that's so important, and you can really get to the bottom of some of the feelings that these parents are having, and really help move their stress away, and hopefully with doing that we can enhance any kind of bonding that we can. Some parents just want to shut down, and stop coming, and stop visiting, and we obviously don't want that. So uncertainty that we learned in the last episode is very powerful, and how it can affect these parents' relationships in the NICU. As NICU nurses, we all like to focus on neurodevelopmental care and try to enhance neurodevelopmental outcomes. But, during this time, how can nurses also, make sure that those outcomes are still met and those milestones are still met, during them experiencing all of this toxic stress, and incorporating trauma-informed care and enhancing neurodevelopmental outcomes?
Yeah, excellent question. They may not be able to, our little pumpkins may not be able to express words, but they can feel what's going on around them. And so, as the NICU nurse, it is so important that, take your deep breaths before you walk into that room, before you approach that baby, and really, go into almost mindfulness mode, where you're with that baby in that moment, calm and peaceful. And then, of course, we all know the importance of developmental care, but, maybe especially right now, we have that extra little cloth that mom wears when she's at home, so we can put that by the baby's nose. And, since parents aren't able to visit as much, I would love to see people use more FaceTime and videos, so that mom can see baby and baby can hear mom. That would be so beautiful. Or even record mom's voice right now if, she's not able to be there as often as she wants to because of, so many different reasons. And just really and encouraging mom to really have a mindfulness moment before she holds baby, so that mom goes into it and enjoys that moment with her baby. Just making sure that it's a peaceful, positive experience, so that our little pumpkins can really grow and feel that safety. I do believe that they can feel that safety, they can feel that love. And so it's important that we really create that atmosphere, and model that behavior at the bedside.
Yeah, and I always, think about using my resources. If some hospitals are lucky enough to have child life specialists around, music therapists, and other multidisciplines that can really help out with these processes, and try to help enhance bonding. So, as a nurse, you don't feel like you have to take all of this on yourself.
Yeah.
You can also bring in other resources. So, you have to really think of what's the best way that we can, maintain that bond. So I know where I work, we use child life and music therapists all the time, to help with that. And, just that little bit of extra support for the parents goes a really, really long way.
Absolutely. Absolutely. And I know one hospital, they purchased some iPads, and, so that they're able to Zoom or FaceTime with the parents, and, in a safe, secure network. And what a great idea. And hopefully that will continue after the pandemic, because, again, for so many different reasons, mom and dad can't be there all the time. So, just what a great intervention that this horrible situation has developed.
Yeah, that's true. We might unlock some secrets during this time that actually might be really, really beneficial, that maybe we might not have thought of unless, we were pushed into a corner, unfortunately, like we are now. So,
Yeah, absolutely. Absolutely.
I know one thing that I'm sure is on the minds of a lot of NICU nurses, and especially ones that are, work in a delivering hospital. We're hearing a lot about horizontal infection, like the risk of transferring COVID from mother to baby. And, how do we kind of make that balance between the supposed risk of horizontal infection versus the risks of, separation and trauma that we were talking about earlier?
Yeah, that's the $1 million question, isn't it? I have to say that I went straight to the evidence, and so it's really important that scientists and clinicians are reporting outcomes that they see to help the rest of us really provide that evidence-based care, and to know what is the evidence out there. And so when I looked, there were a few multi-center studies, one from China, one multi-center study from Italy, and another multi-center study in New York City. And so they looked at COVID positive moms, okay? And of the 127 babies that all of those moms that were born to these COVID positive moms, there was only one neonatal mortality, and that baby was preterm and did not test positive to COVID. And so that is encouraging that these babies did not really have that vertical transmission. But it can't be ruled out. Of course, we don't know for sure that there's not that vertical transmission. And the horizontal transmission is so difficult. It may occur. We still don't know, and that's why we really want moms to practice good hand hygiene when handling their baby if they're COVID positive, including wearing a mask when they breastfeed. But I know the World Health Organization does recommend that moms continue to breastfeed, not just express milk and give it to the baby, but really breastfeed, but using a mask and being safe. If hospitals are, have the extra isolates available, then, while mom is not holding baby, baby can be in an isolate, or at least, 6 feet from mom. That's not ideal. But again, being in the hospital is the opportunity to model the behavior of good hand hygiene, making sure she wears a mask, making sure we answer any questions she has, and being honest when, we really don't know the risk of that. She needs to know that we don't know, and this is hard for us, because as medical providers, right, as healthcare workers, we know a lot of information, but we don't know right now. So really giving her the risks that we can't rule out, horizontal transmission. When we think about separating mom and baby in the hospital, that's 2-3 days of critical time bonding for that mom and baby. But all of these hospitals are sending the baby home with this COVID positive mom. And so I've been looking. I haven't seen any studies yet that have talked about really that neonatal period, or even early infancy. So far, I really haven't seen any complications of later neonatal or later infancy with these moms, or with these babies who are born to COVID positive moms. So again, there may be something that comes out tomorrow. And that's why it's so important that as NICU nurses, we just stay ahead of the evidence, and just, there's not a lot out there. So you don't have to be overwhelmed with all the evidence, because there's just not a lot. And again, those multi-center studies are really helpful, because every hospital practice is different. So, it's good to know that the different kinds of practices that they're doing still has similar results, which is very, very little complications for babies. Now, it'd be wrong to say that there's been no complications, because I believe a couple of the babies have tested positive for COVID, and but there have been no other mortality related to COVID from babies who are born to COVID positive moms.
Yeah, and then, that's all we have is the data that is coming out now, and that's what we have to present to the moms. And as nurses, like you said, we just keep up with the evidence. And as a shared decision, we decide what, the parents can make the decision if that's something that makes them nervous. And, but all we can do is give them the facts and, stay on top of the evidence and present that to them as it comes. So, I think that's what's difficult as a nurse, as a NICU nurse, because we like to have that evidence. We love numbers, so I think that's the struggle that we're having, when we're allowing these moms to breastfeed and do all that. Like, well, where's the evidence? How do we know that that's okay, if that's safe? So,
yeah.
But thank you.
It's definitely weighing the risks. And again, think about your EBP. Here's the evidence. Here's our clinical expertise, what we've seen, what we, know personally as clinicians, and, everyone. Again, it should be interdisciplinary discussion. And then really the shared decision with mom is the key, so that, she's empowered to make that decision and be a part of the team.
Exactly. Hearing you talk about, shared decision-making with COVID-19 and these parents, it really is very comforting as a NICU nurse, because there is so much uncertainty and so much stress for the nurse too. We talk about stress for the babies and the parents, but the nurses are stressed out. The medical team is very stressed. So this conversation has been very comforting to me, because I feel like I've been empowered to really help these parents guide themselves and navigate through this time. So do you have any, closing remarks or closing thoughts on this to kind of help comfort the listeners as well?
Yeah, I'm so glad that you mentioned that, as a practicing NICU nurse, that you're, you have a little bit of comfort with this. And I just want to encourage all of the practicing NICU nurses or OB nurses or postpartum nurses out there, really any of the nurses, we're doing the best that we can. And I think that honesty is so important right now. And so just know, so much about developmental care, and so much about the physiology of stress, and but we don't know about the risks of this infection on babies. And so acknowledging that we just don't know, but here's what we do know, and here's what we don't know. And again, that will mean so much to the parents, and it will take all the pressure off of you. This shouldn't be just a medical team decision. It should always include the parents. So just really, deep breaths. There's those of us who are, constantly looking in the literature to find out more evidence. And as soon as there's more evidence that we know about, I'll be the first to alert NANN and NPA and provide updating information to get it out to everyone in the e-news for NANN and NPA's newsletter. But, everyone is doing a phenomenal job. This is not easy for you on the front lines. And so know that there is a lot of support, and that you guys are doing the best that you can, which is amazing. So thanks to everyone for all you do.
And thank you so much for coming and talking to us and really providing us with so much information and knowledge that we can bring to our units and hopefully empower these parents through this really, really difficult time in the world.
Yeah, you're welcome. Thanks for having me.
As we all know and are experiencing, the NICU environment is ever-changing and facing new challenges every day, being compounded by a global pandemic. It is NANN and NPA's hope that with this position statement, NICU nurses will be guided in a way to promote the dignity of the mother and the baby bond and aspire to improve patient outcomes during these challenging and uncertain times. Make sure you never miss an episode by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.